Welcome everyone to our webinar on the webinar series from the School of Computer, Data and Mathematical Sciences this afternoon. So today we're going to be talking to you about on this subject, how do you do medicine without blood and the guts? So this is actually a webinar that is promoting our Bachelor of ICT Health Information Management undergraduate degree. So before we start, I would like to give an acknowledgement to the country that today we are meeting. We are this online platform. We would like to begin by paying our respect to the local indigenous people, the traditional custodians of various lands from where we are joining the meeting today. And on behalf of the traditional custodians of all these lands, we welcome you all. This is our agenda for today. If you are a webinar participant, you can post your questions through the webinar, the chat box that is available here. And I will introduce the staff who are here, basically myself and another staff member who is present here. And we're going to talk about everything about ICT, Health Information Management course. So what is this course about? What are the career opportunities and what are how you get a job opportunity in this sector? And followed by that, we have a short Q&A session to the conclusion. So I will introduce myself. So my name is Anupama Ginige. I am a senior lecturer in the School of Computer, Data and Mathematical Sciences. And I've been teaching into this degree for many years. And with me here is again one of our engagement officers, Sarah Baker. And if you've got questions, when you post the questions, you'll be able to attend to those. So let's get right into it. What is ICT HIM? But if you take the two acronyms, ICT stands for Information and Communication Technology. HIM stands for Health Information Management. So it is actually two discipline areas. So to tell a little bit about this one, we've got a little video to present first. Let's watch that first.
What is health information management? Health information management professionals work mostly in the hospital system. They are the connectivity brokers in health information for healthcare providers treating the same patient, as well as healthcare managers and administrators who need to fund and plan for healthcare service provision. If you're coming into a hospital or other health facility, they see that systems are in place that ensure you are seen when you need to, that your information is available in the right place at the right time, and that the hospital has quality data that can be reviewed to ensure best practices in place and services are provided effectively and efficiently.
That is a brief summary of what a health information management professional would do work in a hospital environment. And in preparing you to work in a hospital environment like that, we have our undergraduate degree, what we call the Bachelor of ICT Health Information Management. So this undergraduate degree is a 3 years full-time degree with 240 credit points, and that means 24 units of study has to be completed. For people who are listening who are not aware of what are these credit points, what are units, just a little bit of an explanation what credit points are. So different universities has got different ways of measuring the credit points. So we measure a credit point to be, our general units consist of 10 credit points. This 10 credit points is equal to 10 hours of work in a week. So 10 hours a week would cover you attending a lecture, tutorials, practical activities. Then in addition to that, you might be studying on your own, preparing for assessment tasks, doing assessment tasks. All these hours covers that 10 hours. So a 10 credit point unit requires you to engage in the unit activities 10 hours a week. So therefore, if you do 24 of such units, you achieve 240 credit points. Now, a different university, other universities might have 6 credit points, 12 credit points, and their definition of credit points might be different from how we define it. So our degree is offered in Parramatta, Penrith, and Campbelltown campuses. So if you wish to attend physically, and also online, in the online mode as well. So just a little bit more details about how this degree is organized. So in our university, we have basically 3 clusters of schools or faculties, if you like. So we belong to myself, as I said in the beginning, I belong to the School of Computer, Data and Mathematical Sciences. Now, this particular degree, that BICT Health Information Management, is not only offered by our school, but it is actually a collaboration between our school and the School of Health Science, which is in a different cluster. So basically, you can imagine the ICT part comes from our school, and the health information management part basically comes from the other school. So let's have a quick look at the content in this degree, because this is an important thing that actually relates to the topic of this talk, which is called medicine without blood and the guts. Why do we call it? It is medicine without blood and the guts. It's actually worth exploring to see why it is the case. So for easy reference, I have organized the 24 units that I talked to you about before into this diagram. So in this diagram, it talks about 6 semesters. So you would cover 2 semesters in a 1 year. So therefore, over the 3-year period, you will have 6 semesters. Now, these blue boxes indicate the computing units or the ICT units. There, if you read through it, you don't have to read through it, but if you can see that there are a number of programming subjects, there are a number of networking subjects, and system analysis design, database, various components that are very important in health ICT sector, not just in the ICT sector, any sector for that matter, is covered in these units that are represented in these blue boxes. Then also you have these 2 purple boxes that you can see, principles of professional communication and professional development. Now, these are 2 specially designed units to develop the soft skills. Soft skills are a very important qualification criteria that is that the employers look for, communication skills, the management skills, so on and so forth. So these 2 units are particularly designed to improve those. Then we have some data related analytics and data science related units, which are represented in these gray boxes. And then some work integrated units, work integrated learning units. That means that you do learn things by doing practical work, some of them actually in the workplace, and some of them doing projects for the workplace in the university setting. So these maroon color boxes, 3 boxes that are there, integrates these work integrated units. And that's a great way to be prepared for the industry before you leave the university. Then in addition to that, you can see these green boxes, which I didn't talk before about because I wanted to highlight that. If you look through these green boxes, you could see a number of things, like, for example, fundamentals of medical concepts and terminology. Now, this particular unit and things like clinical classification and coding and advanced clinical classification. Now, these are units that are actually talking about the healthcare sector, not just the healthcare sector, and also about the body system of a human beings, and then how do we function. Learn about the diseases of the body system, learn about various treatments that that are associated with these diseases, and then how do we go about recording that and making that data available in an IT system is covered in these green boxes, if you like. Now, this is a very interesting concept from the perspective of learning about the healthcare sector very deeply without being in this, enrolled in, if you like, a medicine degree. But this is in addition to the technology part that and other components that we cover. Now, this is basically the core structure of our Bachelor of Health Information, ICT Health Information Management course. Now, moving on, I have again listed various items that you study in the same, using the same color scheme. So you learn programming, Java, various number of programming languages that are used in the health in the IT sector. And we have database, and we have industry-based certificates in the networking units, and human-computer interaction, system analysis and design, again covered in the blue units. And then the human body system, anatomy, physiology, pathology, all of that. And coding, working with the hospital system and the hospital records, and also getting to know about the healthcare system in Australia and data, and then the funding methods. These are very, very important concepts for you to learn if you wish to work in the healthcare sector in Australia. All right, let's move on to the next slide. Now, in completion of this degree, there are a number of opportunities that you can, job opportunities that you can apply for. These include, you could be an IT personnel working within hospitals or any healthcare organization and insurance organizations. Now you can imagine these sectors are very much will be in business in many years to come. And as these areas, these organizations go digital, we use more computers, there is the big demand for people with technology and the skills, technological skills, as well as the subject domain skills that are needed. And also you have some specialist group called as classification analysts. So these are people who are working with the healthcare data. And clinical coders, the clinical coders, these are not from the perspective of programming coders, but these are people that will work with the hospital data records or episodes of care, as we call them, that of patients, and code that information, provide codes for that particular episode of care using an international standard. And so use of that international standard, and you're learning how to use that international standard in the hospital setting when you are coding a patient record. And when you are doing that when you learn this international standard, one other good thing is you actually get qualified to work globally as well. It doesn't mean that you have to work in an Australian hospital. These international coding standards are used in other countries, Canada, UK. If you ever decide to move to another country and start working there, you are very well equipped to do that as well. So this even applies to health information, clinical information managers and health information managers. So these are people who are actually managing healthcare centers, hospitals, just so that you know, these are not managed by doctors and nurses. These are managed by specially trained people who go through this kind of degrees. Let's look at, let's actually hear from some of the people who really work in these professions and what they do. I'm going to play another little video for you to listen to.
My role at the moment is working as an industry solutions director for a software company, which entails me to travel around the world and helping organisations, health organisations, understand where better value can be derived from their data systems and sources.
I work as a classification analyst for a government agency that develops and maintains classification systems for services provided in public hospitals.
I'm currently working as a clinical coder in a large private hospital. My duties are to code all patient episodes of care, follow up on doctor coding queries, as well as submit all data to the health funds and Department of Health every month.
So I'm currently working as a clinical coder. I abstract and translate clinical information from a patient's medical record and apply alphanumeric codes in accordance to a specific classification set.
I'm currently working as a clinical information manager at a metropolitan hospital in Sydney. The role's really diverse. It enables me to be involved in different activities around the hospital, such as requests from the executive that influence service delivery, business analytics and privacy legislation and medico-legal requests.
My current role within the HIM profession is a health information management trainee. So within this role, I rotate through some hospitals within New South Wales Health and in a variety of departments such as performance monitoring, clinical coding, patient services and information, as well as medical records.
I'm the general manager of a company that provides contract clinical coders, auditors, and health information managers in health facilities across Australia.
As you can see, there is a range of job opportunities that were highlighted, by professionals who are in the industry sector, who have studied degrees similar to this one that we are talking about. All right. Okay, I think this comes to the end of our presentation, short presentation today. If you have any questions, I'm happy to take them on now.